My subject is ulnar collateral ligament damage. My name's Justin Dines. Just imagine all of your dreams, your ambitions, and everything you've ever worked for in your entire life are just all of a sudden taken away with a chance you may never be able to get them back again. This is the case with many pitchers around the world, both young athletes to pro athletes and everybody in between. This presentation will help you identify, prevent, and deal with ulnar collateral ligament damage. How many baseball players do we have? 2? All right. Do you all know another name for ulnar lateral ligament reconstruction?
Tommy John.
Tommy John surgery. All right. A little bit of history behind Tommy John surgery. Tommy John was a pitcher for the 1974 LA Dodgers, and he was the first recipient of the surgery itself. He got the surgery, and the surgery was later named after Tommy John. A little bit anatomy behind the elbow was there's 2 ligaments in the elbow, the ulnar collateral ligament and the lateral collateral ligament that hold the humerus, the upper bone of the arm, to the lower bone of the arm, the ulna, together. The ulnar collateral ligament is located on the inside of the elbow. It is made up of the anterior bundle, the posterior bundle, and the transverse. It makes up a triangle shape. Some of the causes of ulnar collateral ligament damage involve repetitive throwing without much rest in between. It also involves if there's more force on the arm itself through the motion than the strength of the tissue itself in the arm, this will start to cause micro tears in the arm itself. And these micro tears will continue to form until the ligament is ruptured, and therefore the surgery will be needed. Some of the symptoms and signs that a person can look at before it comes to this point: there can be pain on the inside of the elbow. There will be a tingling feeling from the funny bone down through the arm into the pinky and the middle finger. There will also be swelling and a loss of power when throwing a baseball itself. The diagnosis that can be done is an experienced doctor can just take a look at the elbow itself and determine what's wrong with it. You can feel a loose feeling in the elbow, or if the experienced doctor, or is not experienced as he should be, can't decide what is wrong, MRIs and x-rays are the next best bet in dealing with ulnar lateral ligament damage. There are many treatments that can be done. The first treatment that can be done to solve the damage itself would be non-surgical treatment, and this involves resting the arm for a period of time, icing the arm also. Different things can be done to improve the mechanics of the pitcher himself. The arm slot that the pitcher releases the ball, the release point, if the elbow is below the shoulder, this causes more force on the elbow itself, causing more micro tears and leading up to the ligament rupture itself. Another thing that can be done is inflammatory drugs may be prescribed to the patient, but this does not always work. In this case, surgical treatment may be taken. An arthroscopic approach to the ligament damage is the lesser of the 2 surgeries that can be done. The surgeon makes an incision on the inside of the elbow. He then inserts a camera into this incision to look at the ligament and see what exactly is going on. He can clean out the area, and if the ligament is not completely ruptured, he can then decide if it can be reattached to the bone itself if it has just been pulled away. By doing this, it's called a docking technique. 3 holes are drilled into the humerus bone, the upper bone in the body, and 2 in the lower. He then takes the ligament and in a figure-8 motion connects it back through these holes, drawing the 2 bones back together, and then sutures it back to itself. If the ligament is completely ruptured with no repair at all, he must harvest a tendon from another part of the body, such as the forearm or the knee, which is the most common harvesting spots. He then takes this tendon, takes the ligament out, and then the same process puts the new tendon back through just as he did before in the docking technique in a figure-8 motion, and then sutures itself back together, causing the humerus and the ulna to draw back towards each other. Now, the rehabilitation after this surgery is much different from the arthroscopic approach to the reconstruction itself when you pull a tendon out of another part of the body. In the arthroscopic approach, The rehabilitation is not as bad. It usually takes 1 to 3 months to get back on the field at full power. The first thing that is done is gentle ranges of motion are started and strengthening exercises on the elbow itself. You then start a throwing program and gradually increase in power as you get stronger and get back into the game. In the surgical approach, where the tendon was actually taken from another part of the body and put back into the elbow, it takes close to 1 month to a year, depending on the strength of the individual. Right after surgery, the individual or the patient is put into a big bulky cast where he can't move at all, and the only ranges of motion he has are his wrist and his shoulder, where he starts strengthening exercises on that. After 10 days, the cast is then taken off of the individual, and gentle ranges of motion are then started along with strengthening exercises and throwing programs such as the arthroscopic, or like they did in the arthroscopic surgery. They then go 5 to 6 months, he'll be back on the field, but he won't be at full potential, and then after 11 months, after all the rehabilitation and therapy and everything else, he'll be back on the field playing the game we love. In conclusion, the UCL, or the ulnar collateral ligament, is the main and vital part of a thrower's arm when it comes to baseball pitchers. And in this presentation, I've showed you how to identify, prevent, and deal with the ulnar collateral ligament damage. And if people care for their arms more and take more precautions, then maybe they would be on the field more instead of the doctor's office playing the game that they love. And these are my references. Any questions?